Hello, it's the nursing professor, and it's Professor Jones, and today I'm talking about the cardiovascular system. The heart is a muscular pump that pumps oxygen, rich blood, and nutrients into the body, and it provides the body with the oxygen and blood that it needs in order to function. So one way I was trying to think of how to help, you remember arteries and veins and what they do. So I think of arteries is away. It takes blood away from the heart. Veins bring blood back to the heart. So arteries away, veins back to. So I made a small little diagram, don't laugh at my diagram, of the heart to try to explain this. There are also this is called the pericardial sac that the heart sits in. And there are 3 layers to that. And the layer that's closest to the heart is called the endocardium. And then the middle would be the myocardium and the outer would be the epicardium. So just that'll come up when you hear about the different diseases that can go or things that can go wrong with the heart. So veins, we are going to remember that veins is going back to the heart. So the right atrium, so there are 4 chambers. I didn't say that. There's a right atrium, a left atrium, a right ventricle, and a left ventricle. The right atrium gets blood from the superior vena cava and the inferior vena cava. So blood comes in, it gets into the right atrium, and we have different valves. The valves help to just close off areas until the pumping action occurs. So what happens is the blood gets in here and it fills and it goes on into the right ventricle. And you see I have arrows going down and in, because once this fills, the ventricle pumps and it closes the tricuspid valve. So you don't have regurgitation, and it pumps up through the pulmonary valve and into the pulmonary artery and into the lungs. So now this side of the heart, the blue, is signifying that this blood is unoxygenated. It doesn't have oxygen, so it's going to the lungs to get some oxygen. Once it has gotten oxygen, it comes in through the pulmonary veins into the left atrium, then it'll flow down into the left ventricle. Once it gets full, the mitral or bicuspid valve, is called both things, will close, and then the blood is forced up through the aortic valve in and out through the largest veins that you have in your body, which is pulmonary arteries. So it goes out into the pulmonary arteries and then into your body for your body to use. So this is like a basic understanding of, blood flow. This is the septum, and that helps to separate the right and the left sides of the heart. So here, like we said, no oxygen is in the right side. It's unoxygenated blood. And you have the right atrium, the tricuspid valve, the pulmonary valve, and the right ventricle. On the left side with the oxygenated blood, you have the left atrium, the left ventricle, the mitral/bicuspid valve, along with the aortic valve. And this blood, once it's oxygenated, it came back from the lungs, goes out to the body, and the body is then able to use the blood for the body's function. So there are many things that can go wrong if you think about this diagram. So you could have problems with, again, the biggest thing everybody knows about is a heart attack. So that would basically be a blockage. So think about a blockage and the damage it would do in this kind of a flow. That would be a problem. Also, you can have atrial disorders where the atrium is fibrillating instead of squeezing in order to pump the blood. You could also have ventricle disorders where the ventricles are not pumping hard enough to get the blood up and out through the valves. So when you look at the heart, you can kind of figure out like, oh, wow, yeah, this would be a problem too. Same thing as I talked about, there's a pericardial sac. If you think about the sac, what if it became hard and fibrous? Then there's more pressure. It's harder for the ventricles to then contract. So then you'd have problems with the pericardial. So you could have pericarditis. You could have, then that would be an infection of the sac surrounding the heart. You can have ventricle disorders where your ventricles are thickened and they no longer pump the way that they normally would, or in a healthy heart. And if you think about that, then you'd have pooling. So now you got a risk for clots. So you see how it can just go on and on and on with the things that can go wrong when your heart is not pumping in the way that it should. Also, you think about hypertension, and this kind of brings it to view, where you can understand if these things are tightened and there's so much pressure, that's a problem, because now your system's constantly on that pressure, and it's not able to function in the way that it normally would, because there's so much pressure on the valves, on the arteries, and all of that. So hypertension is an issue. Heart failure also is when the ventricles don't pump well enough, and now you have like just blood that's sitting there. It doesn't move as well as it normally would. So assessment, some of the assessment you do just by looking at the patient, are their lips blue? What do their fingernails look like? Are they normally pink? Do they blanch when you touch them? What is the person's capillary refill? You can also look for signs of edema in the lower extremities. These would all give you clues on, what's going on with their heart function. Bruising, of course, a blood pressure would help you with assessment, as well as you could do palpate the different pulse points. So there are several pulse points where you can feel a heart rate. The one that most people know about is the carotid. Then you also have the radial, and there's also the brachial pulse. We normally use the radial and the carotid. There's also a femoral. There's plenty of pulses that you can take to figure out, okay, let me see what the heart is doing. The big one is auscultation, and that's when you take your stethoscope and you want to listen to the heart sounds. You're listening to the lub dub, which the lub is basically what you're listening to when you're listening to them. I don't know if people really understand that, is you're listening to the valves close. The valves closing causes the sound that you hear. So when the tricuspid and the mitral valve, when these valves close, these two, that's the lub sound. Then when these two close, the pulmonary valve and the aortic valve close, that's the dub sound. So I don't have something for you to hear what the heart sounds sound like. So I would recommend going on YouTube and listening to a heart sounds video, because it will really cover the difference in the sounds, and you could actually hear it. Nursing diagnoses that have to do with cardiovascular system could be risk of impaired cardiovascular function. And that would work if you saw somebody with like high blood pressure, but they were compensating, but you can see that something might be happening, they're at risk. Decreased cardiac output, that can also be potential for excess fluid volume. It could also be impaired gas exchange. And anxiety. Anxiety goes with a lot of different diagnoses that can go on with the patient, because anything can be anxiety producing when you're talking about something wrong with different systems of your body. So there's cardiovascular system in a nutshell, quick and dirty.